patient in Trendelenburg, and the reason for that is we want to wash out the pocket because the solution to pollution is
dilution.
Dilution, right. So we want to wash out the pocket, make sure that no bacteria got in there, any little pieces of fat. Oh yeah, by the way, when we're dissecting our way down, unlike the people in Sao Paulo, Brazil, who believe...
Calling them out now, are you?
Yeah, and they believe that you should do liposuction at the same time as a tummy tuck. We don't agree with that, do we?
Nope.
That's right. We don't agree with that. We think you should do liposuction
90 days.
90 days after, thank you for reminding me, 90 days after the tummy tuck, and because we're invoking the delay phenomenon, and next, we also feel that you shouldn't liposuction at the same time as the tummy tuck because you're not going to be able to do as an aggressive liposuction as you can 90 days later. Once we get them into Trendelenburg, then we flex the table to 30 degrees, and the purpose in that is making things really tight. The patients don't pay for loose, do they? No, they want it tight. They want the incision low, and they want the stomach tight.
So they can wear their little itty-bitty bikinis in Hawaii.
Very small bikinis in Hawaii, that's right. And so then the next thing we would do is pull everything down, decide where we're going to make our incision, how much skin we're going to take off, and then we do that. First we do the area, one half of the pubic area, then we do the second half of the pubic area, then we go to the sides. And certainly in my residency, I was taught to make my incision up on the side, or because that's the way the skin tells you to go, but that's not the way we do it.
It's lying.
What we want to do is keep the scar below where the smallest bikini would be. And so instead of following it upwards like a high lateral bikini, we keep it low, and we cut the skin. Then once we cut the skin off, then we close it first with what?
Wait, pause. It's like a high-waisted bikini, not a high lateral bikini.
High-waisted bikini. Is that right? High-waisted?
Yes, like
Okay.
high-waisted bikinis.
Let's go back to bikinis. It's a high-waisted bikini, not a
Yes.
high lateral bikini.
Thank you.
We don't care how long the scar is. We care how low it is and how fine it is. So we put multiple sutures in below the surface, taking the tension off the surface. And we learned that little trick from Ted Lockwood from Kansas City.
Thank you, Ted.
Yeah, he was the guru. So we first put S. Jackson, that's a company, and it's a it's an O-braided polyester. Then the next layer we put Insorb, and that is
Upside down absorbable staple.
upside down absorbable staple. And the next layer, which Brandi's particularly good at, is the subcuticular suture level, and we use
3-0 monocryl.
3-0 monocryl
PS1.
on a PS1. And Brandi gets that just so perfect that you could quit at that point, but I don't, because I'm kind of a belt and suspenders guy. And so we then use staples and floral black nylon, which come out at 3 days. And just before the final closure, we put in 3 10-millimeter Jackson Pratt drains, and one goes to the right, one goes to the left, and one goes up the middle. And their purpose is draining the abdominal wall, and they come out at 3 days as well. I've been fortunate in not getting any trouble taking those out, and we secure them in the pubic area with 2-0 silk suture. And then belly button. Oh, I was going to forget the belly button. No, I don't think I was actually going to forget it.